Selecting the right medical certification for your patient plays a critical role in their recovery. If they can still do some of their duties at work while injured, it can actually help them get back on their feet faster. There's strong evidence that staying connected to work is good for both physical and mental well-being. There are 3 kinds of medical certifications you can provide, depending on the person's injury: fit for selected work, fully unfit, and fully fit for work. I'm going to explain the fundamentals of medical certification so you can choose the option that is best for your patient. A medical certificate documents your assessment of a patient's capacity to engage in any work and their ability to take part in rehabilitation for their injury. Issuing the right certification to match a person's injury and circumstances means that they can get the appropriate support from ACC to recover, including treatment, rehabilitation, and weekly compensation. Anyone in Aotearoa, New Zealand, who is employed and is injured in an accident can be eligible for weekly compensation. The correct type of medical certificate not only determines whether the person needs time off work to recover and financial support from ACC, but is also an essential part of your patient's recovery plan. In many situations, your patient will still be able to engage in some work while recovering, although it may mean doing slightly different duties than their normal job. It could be doing fewer hours, lighter tasks, working with modifications, or in a different environment. If you certify a person as fit for selected work, their employer could pay for their productive hours, and ACC can top that up with weekly compensation. Being able to perform some tasks may mean your patient can earn up to 100% of their pre-injury income rather than 80% just on weekly compensation. But more than that, the international evidence shows that recovering at work is beneficial in other ways. It means the person can keep earning an income and stay connected to their workplace and workmates, who are often a key part of their support networks. They can keep their skills sharp or even learn new ones. Getting back to work earlier also means it's more likely they'll remain in employment. It's important to know that even if their employer has no alternative duties available, your patient will still receive weekly compensation. Let's say a truck driver suffers a fractured ankle while working in the forestry industry. There will be parts of their normal job they can't do, like driving, walking, or lifting. But if their employer agrees, they might be able to do other work, like helping with administrative tasks. There will be times where you need to certify a patient as fully unfit to work. They may need to be admitted to hospital or are confined to a bed, need to isolate because of an infection risk as a result of their ACC-covered injury and can't work remotely, or pose a specific health and safety risk to themselves, their co-workers, or the general public. If your patient was working at the time of their injury, they can receive 80% of their pre-injury earnings while on a fully unfit medical certificate. A person sustained a severe traumatic brain injury or requires pain medications as a result of their ACC-covered injury, which is having a significant impact on their cognitive ability, posing a health and safety risk to themselves or others. The third and final category is fully fit for work. This means your patient can perform the full range of their pre-injury job. Even though they will no longer receive weekly compensation, it's still important to complete this so your patient can receive the appropriate ACC-funded support for their recovery. Someone who's fully fit for work might be an office worker who has sprained an ankle but can still complete all their pre-injury duties and hours. While they will no longer receive weekly compensation, they are still able to receive ACC-funded treatment for their injury. As your patient's primary care provider, you have an important role in supporting their recovery. Completing an assessment of their capacity to work plays a key role in helping your patient to recover at work and return to their everyday activities as soon as possible. And that's the basics of medical certification. If you need more information, there is plenty of resources on ACC's website. Thanks for watching.